Part A. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I understand you've been experiencing some terrible bouts of abdominal pain for the past few months. Could you describe what's been going on in a bit more detail?
Good morning, doctor. Yes. It's usually in the lower left side of my abdomen, and it comes and goes. At first, I thought it was just something I ate, but it's getting worse. The pain can be so intense that I feel nauseous, and sometimes I have a bit of fever when it flares up. I've also been really constipated, but when I do manage to go to the bathroom, it can be quite painful.
I see. It sounds like the pain is quite disruptive. Have you noticed any other symptoms?
Yes, unfortunately. I feel bloated all the time. Sometimes my stomach is so tight, and I've also noticed some changes in my bowel habits. Like I said, I'm constipated most of the time, but then I have these short episodes of diarrhea. I feel like something's wrong, but I don't know what.
That must be quite uncomfortable. Let's go over your medical history. Have you been diagnosed with any gastrointestinal conditions in the past? Are you on any regular medications?
Well, I've had issues with irritable bowel syndrome in the past, but nothing like this. I've been taking Buscopan on and off for the cramping, and I tried lactulose for constipation, but it's not really helping anymore. My GP also prescribed mebeverine a few months ago to relax my gut, but I've stopped taking it because I didn't feel much improvement.
And how long have you been dealing with these symptoms?
It's been almost 6 months now. I thought maybe it would just go away, but it's only getting worse. My diet hasn't changed much either, so I don't understand why this is happening now.
I understand. What about your family history? Any relatives with digestive disorders or similar conditions?
My father has had some issues with peptic ulcer disease, I believe, but nothing serious. He was told to eat more fiber, and it's been manageable for him. But I don't think that's what I have, doctor.
I see. Given your symptoms, particularly the abdominal pain, changes in bowel habits, and bloating, I'm starting to suspect that you may be dealing with diverticulitis.
But I thought that was more common in older people. I'm only 40. I'm just not convinced, doctor. So, how do we confirm if it's really diverticulitis?
We'll need to do some more tests to be sure. I'd like to order a CT scan of your abdomen. This will give us a clear picture of the colon and whether any pouches are inflamed. We may also run some blood tests to check for signs of infection.
I've already had an ultrasound, though, and nothing really showed up. Will the CT scan be different?
Yes, the CT scan is more detailed than an ultrasound for this type of issue. It can help identify small abscesses that an ultrasound might miss. Based on those results, we'll have a better idea of the exact cause.
All right, I understand. But what's the treatment if it is the case?
Treatment usually involves antibiotics to tackle any infection, and will adjust your diet to help your digestive system heal. I'd recommend starting with a low-fiber diet during flare-ups to give your colon time to recover. Once the inflammation settles down, we can gradually reintroduce more fiber to prevent future episodes. Thank you, doctor. I just hope we get to the bottom of this soon.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you feeling today? What brings you in to see me?
Good morning, doctor. Well, I've been having these chest pains for a few weeks now. It's not exactly sharp pain, but more of a heavy pressure. It tends to happen when I'm walking or going upstairs, and sometimes my left arm feels numb or tingly. I also get short of breath quite easily, which is unusual for me.
I see. That sounds concerning. How long have you been experiencing these symptoms?
It's been about a month now, but it's getting worse. At first, I thought it was just because I wasn't exercising enough, but now I feel exhausted even after doing simple things like grocery shopping. The heaviness is the most uncomfortable, especially because it makes me anxious. I can't do the things I usually enjoy, like walking with my friends.
Thank you for sharing that. These symptoms could be linked to several cardiovascular conditions, so let's talk about a few more details to get a clearer picture. Do you have a family history of heart disease or any other medical conditions?
Yes, my father had a heart attack when he was 55, and my mother has high blood pressure. My uncle also had a stroke a few years ago. Heart problems seem to run in the family.
That family history is important to note. Based on what you've described, I'm concerned that you might have atherosclerosis.
Oh, wow. That sounds serious. So what's the next step?
We'll need to run some tests to confirm the diagnosis and see how advanced the condition might be. I'll start by ordering a blood test to check your cholesterol levels, as high cholesterol can worsen plaque buildup. Next, we'll do an electrocardiogram, ECG, to measure the electrical activity of your heart. I'd also recommend a stress test to see how your heart performs during physical exertion. Lastly, I may suggest an angiogram, which is a special type of X-ray that allows us to see how your blood is flowing through your coronary arteries.
That sounds like a lot of tests. What happens if I do have this condition?
If the tests confirm the condition, we'll need to start treatment immediately to prevent further complications. Treatment often involves lifestyle changes, medication, and sometimes procedures to improve blood flow. I'd recommend medications like statins to lower your cholesterol, and possibly aspirin to help thin the blood and reduce the risk of clots. We may also consider beta blockers to help reduce your heart's workload.
How long would I need to take these medications?
Typically, these medications would need to be taken long-term, potentially for the rest of the life, to manage the condition. We'll monitor your progress with regular checkups.
Thank you, doctor. I appreciate it.
That is the end of your OET listening test. Now check the answers.